If you look back historically, there were usually very energized elders who felt the most important thing to offer was long-term care services for our own people, on our own lands, by our own people. And that's a recurring theme.
As a tribe, one of the most important relationships that we have is to work both not just locally, but state and national, and keep a handle on all of those entities and how they play a part in terms of what we plan to do, what direction we plan to go. And, you know, Oneida has always been a pretty progressive tribe, and I think that has helped us in terms of looking forward to say, what kind of relationship do we have to make it beneficial for the tribe itself, and what kind of model can we put into place so that other people can benefit from the work that's been done here.
So one of the things that I think is very critical for Native programs in long-term care is forging the relationships with the departments in the state that they're in, their Medicaid directors, the directors and the administrators of their Department of Human Services, and the policy analysts. So you have a working relationship with both sides of those programs in the state, because those programs are critical to long-term care funding and long-term care needs.
It took us a number of meetings to figure out that we were actually talking past each other with the state. The state would be using the same terms with different definition. And so in order to fix that, we did something very simple, was put together a glossary of terms with common definitions. That simple thing of putting together a glossary made the education go much faster, much easier, and it was the education in the long run that allowed us to make a lot of the inroads with the state.
I have come to believe that once they are educated, once they understand, it opens the doors. They want to collaborate, they want to help.
So what we try to do is coordinate all these services in such a manner that everybody knows which person and which department's providing the service, as well as being able to say, because of your age, because of your income, you may qualify for funding from, say, elder services and not transit. So we try to appropriately match the person with not only the services they need, but from a provider standpoint, we try to make the money and the funding go as far as it possibly can.
When you have a long-term care facility like a nursing home, what drives your rate is an assessment called the MDS. Having your nursing staff know how to complete the MDS correctly so that you capture the highest rate of revenue, but then you have to work very closely with the state and say, how can we capture that enhanced rate, and working closely with them and double checking their calculations.
When we first tried to get some more services eligible for 100% FMAP, we honestly thought that our biggest fight was going to be with CMS. And so we did arrange a series of meetings with the tribe, CMS, state representatives from the Department of Health, and Indian Health Service. And much to our surprise, CMS and the state were totally on board. They understood immediately that this was a good thing and supported us. Once we were able to get the 100% FMAP, that then allowed us to get an enhanced rate. So instead of getting the Medicaid fee screen from the state, we were able to claim what's referred to as a federal MA upper limit, which is closer to a Medicare rate, which is much higher. We do the same thing here at the health center for all the direct care services we provide.
Throughout the years, what the tribe has gotten much better at is formalizing needs assessments of their elders.
I think one of the biggest things as we move forward was basically incorporating the support of our Commission on Aging and presenting to the community and showing the numbers and showing the data so that everybody could see this was the justification for how we move forward. I think that was critical in terms of actually getting our elected officials' buy-in is showing this is the need, here's the numbers, this is why we need to support this.
Now we've gotten sophisticated enough that we still do community meetings and we solicit input from the community at a regular interval. But we've also partnered with some of the colleges in the area, and we do a very comprehensive 5-year community needs survey that points out any gaps that we happen to have in service. We're trying to set up the evaluations in such a way that not only do we create more efficiency within the system, but that we create more customer and client satisfaction all at the same time.
Traditionally, we're a matriarchal society, and I think the planning that has gone into long-term care services, as well as any of the other services, is a piece of that culture. One of the teachings always has to do with the 7 generations, that we're always planning to look for the next 7 generations ahead in terms of what we do. And I think that cultural component of that is what has driven us to incorporate a lot of those things that we do. I think one of the things that that was a critical element was their persistence. They didn't give up. You know, they continued to move it forward.